The public hearing was packed and stretched 2 hours past its scheduled 8:30 p.m. end time. A handful of supporters testified in favor of Speaker Therese Terlahi's bill to make medical malpractice arbitration optional and to add a court magistrate hearing as a recourse.
The medical business is a business. It's a business that has an unfair advantage over every other business on the island. Because in any other business on the island, if there is a situation, the patient or the customer has legal recourse. I've read Bill 112. I see it accomplishes a major policy goal that could be a good benefit for a small part of our community. And those are the people seeking recourse from legitimate and justifiable complaints made by mistake or accident or neglect that dramatically impact their quality of life.
But the rest of the testimony was mostly from healthcare professionals opposed to the bill. Their consistent concern: removing mandatory arbitration cracks open the door to more litigation against them.
What we are saying is that while we want to take care of patients, Bill 112 will create such a litigious healthcare environment in Guam that we cannot afford to take on the additional liability that comes with extending ourselves to try to compensate for the gaps in the healthcare system on island.
I believe that the problem we are debating is whether we prioritize the health and access to care of the community at the expense of the individual, or do we prioritize the individual's access to due process at the expense of the community? There needs to be balance, and I am all for working together to find a more balanced solution. But Bill 112 is not the answer.
It's not the answer because the unintended consequence, say the providers, will be the chilling effect it will have on their practice.
If this bill passes, I will no longer perform elective surgery on pediatric patients. It's not because I don't know how. It's not because I don't think I'm good at it. It's because malpractice insurance will not cover me to care for pediatric patients because I am not a pediatric surgeon.
Most physicians in Guam have been practicing far and beyond what we have spent years training for. And in doing so, we have willingly exposed ourselves to potential malpractice. We do so because if we don't, nobody will. And if we don't, we may not give our patients a fighting chance to survive.
Many agree that those with legitimate claims should not be deprived because of cost, but finding that balance remains elusive.
I wholeheartedly agree that there needs to be a way to increase legal access for members of our community who have experienced a bad outcome as a result of medical malpractice. But this should not be done at the expense of our current healthcare infrastructure that has allowed hundreds and thousands of Guamanians to get the services they require here at home.
The point of arbitration is not to act as a barrier to justice. It's a filtering system so that any claim will be evaluated by knowledgeable people first. The cost is what we need to focus on, not the process itself, finding that solution.
Bill sponsor Therese Terlahi closed the hearing saying a lot more discussion is needed.
I don't know, I'm going to have to try to find a way for us to have a dialogue, so we're going to probably have to just have more roundtables with maybe smaller panels or groups or something, because I know they have questions and they have lots of things to say as well.
The next hearing is set for Monday, July 12th.